they don't even have a bank account, even though they get a check on a regular basis. These people spend more than $8 billion every year at check cashing outlets, payday lenders, and pawn shops. They can spend $1,000 a year just to cash paychecks. Never mind these refund anticipation loans and all these other things that they sometimes take out just to pay their bills. We already have negative savings in America for the first time in 70 years, and that's before we calculated in the collapsing value of homes, where Americans have already lost $2 trillion in wealth in the declining value of their homes. The average full-time unbanked worker will spend more than $40,000 cashing paychecks over a career. If that money were instead invested over the same career, it could yield $360,000 in pre-tax wealth, enough to finance many years of retirement security. There are more check cashing, payday loans, and pawn shop outlets in America than there are McDonald's and Starbucks stores worldwide. This is not a small issue. Now, more and more cities and states are trying to regulate these practices and cap payday loan fees. Hillary, as a member of the Armed Services Committee, supported their efforts, their bipartisan efforts, to cap payday loan fees around military bases. And now the federal government is getting into this. The FDIC's Alliance for Economic Inclusion is working on it. This is an issue that liberals and conservatives, Republicans and Democrats should all be able to agree on. If you want the free market to work, the average working stiff should be able to have an ATM card and establish a credit rating and pay their bills at no larger cost than the rest of us do. This is important. So we're working very hard on this. We're trying to go around and help people, educate them, get them into the banking system, work on it. San Francisco has done a particularly remarkable job with this. They wanted last year, with a project called Bank on San Francisco, they said, let's see if we can't just get 10,000 more people into the banking system, and they beat that by a good ways. It's not true that people don't want to do this, but it's hard for those of us who don't ever think about this to imagine that in a world where people are really scared about their money for good and sufficient reasons, we still have millions of our fellow Americans, many of them with children to support, who are hiding their cash in cans and under beds. And so I would just, my offer stands here. If any of you are interested in this, you want to contact our foundation, we do a lot of work. And we also have partnerships with people like Project Hope to actually educate people about credit and make sure that they don't just get in a banking system and then get in trouble because they're in the system. But I think that's important. The last thing I'd like to mention is the childhood obesity issue. We have a partnership called Alliance for a Healthier Generation with the American Heart Association to try to reverse the tide of childhood obesity and the number of children, this is a particular problem, who are developing type 2 diabetes. This has gotten so bad that the American Heart Association, the American Medical Association said in the last couple of years that it was no longer appropriate to refer to type 2 diabetes as adult onset diabetes. In Harlem, where my foundation office is, we actually had a 9-year-old boy diagnosed with type 2 diabetes, the kind you are not born with a predisposition to, in the last couple of years. So we're trying to do what we can. We've made agreements with the snack food industry and the soft drink industry, and I'm really proud of the fact that there has been a 41% reduction in the calories in the products being shipped to our schools now from these people. That's a big deal. We have 750,000 kids, 750,000 who have accepted the partnership we did with Nickelodeon it's called the Go Healthy Challenge, and these children promise to make their lives healthier and try to change their families and communities, and they do. There was a young man in North Little Rock, across the river from where my library is in Arkansas, who was a Katrina refugee, about 5'8". He lost about 40 pounds, and his mother lost 40 pounds too. So we are beginning to change the culture, but we all have to be involved in this. The Robert Wood Johnson Foundation has given us the money to support schools in all 50 states to try to help improve exercise opportunities and diet offerings, and also to involve the school staff. We're going to support 8,000 of them in the next couple of years, and eventually we want to do 25,000. And again, I want to thank the mayor here and all the people in the Miami-Dade County Public School System, because they have been a leader. The Michael and Susan Dell Foundation has helped to fund this, as well as local philanthropists here, including the Kesslers, friends of mine, and others. They're really doing a good job here in Miami, and they got a lot of challenges. And let me just say one final thing about this. This obesity thing has a cruel racial and ethnic aspect that is entirely tied to genetics. And we have not yet, even with the sequencing of the human genome and all the applications that have been done, nobody's been able to entirely unpack that, but here are the numbers. Given a constant food intake in volume and substance, and a constant level of exercise, whatever it is, good or bad, Pacific Islanders and Native Americans are 2.1 times as likely to develop diabetes as those of us from European heritage. African Americans 1.8 times as likely, Hispanic Americans 1.7 times as likely. But it means that the cities bear the lion's share of this burden too, because we're more interesting now, because we're more diverse, because we're growing. But we have to deal with this. And again, I want to say that if we can do anything to help, we will. And I want to thank the people in the Miami area who have really stepped up to the plate on this. All these epidemics, by the way, these health problems and the economic challenges and the rising temperatures are going to be increasingly related. And I know I don't need to tell you that, but global warming has played an enormous impact in rising energy prices in the food crisis in the world today. Food prices are going through the roof, and that's causing a lot of problems around the world. We're going to have far more health epidemics, and we're going to have a very hard time making income stretch unless we do something about it. So that's my last point. There has never been a moment, at least in my lifetime, when I think your job was more important than it is today. Because every time you do something to improve public transportation, every time you do something to save energy, you also are creating more jobs, creating more security, stabilizing families, reducing crime. All this stuff is interrelated to an extent that, at least in my lifetime, or at least in my awareness, has never been equal in the past. I am quite optimistic about the future, but it's going to take the doers and the problem solvers. I'm glad we're going to have changes in federal policy, but somebody's got to take the good policy and the good intention and turn them into real changes in our people's lives and our children's future. That's you. Thank you very much.
Okay, one quick housekeeping item. The staff of the Clinton Climate Initiative is doing a special workshop, as President Clinton told you. It's going to take place. It's going to take place in the Tuttle Room,
Downstairs.
downstairs lobby, the Tuttle Room.
Executive